Hello, everyone. It's an honor to be invited here by the FAM to talk about innovations in e-health. And I'm going to look at this issue from a specific prism, that the perspective of startups. So speaking as an entrepreneur, I kind of toured Africa, scouring it for innovations over the past 3 years. And I wrote, as a result, over 500 articles on technology in Africa, and in particular e-health technology, writing for several media. But I also write articles for big dailies in France, Le Monde, Les Echos, and I presented my book at the Vivatech fair last week. The former head of Google in Africa, and Xavier Nuel, a big telco CEO, wrote the preface to my book. But I think that there's now renewed interest for African innovations, especially in e-health. So I talk about e-health, but I also talk about energy and education in my book. Dozens of startups that are changing the daily lives of Africans and really are changing the way Africa is developing, thanks to technology and innovation. And so in my book, there's a whole chapter on e-health. And I'd like to give you a few ground-level examples of e-health initiatives that are helping to transform lives. So thanks to digital technology. So the book will become available as of Monday on Amazon. So you had a map of my travels. I am also an ambassador for the Pierre Fabre Foundation in Africa, ambassador for e-health ecosystems. And I work with Beatrice Garrett in the e-health observatory in the Southern Hemisphere. And many of the initiatives that I reported on are part of that observatory, or were identified by the observatory. Here, I'm in a startup that works on durably fighting maternal and child mortality. In 2016, there was an event in Cameroon which really triggered a political crisis. Pregnant women were found not to be taken on and monitored, and this ended up with a woman who had an extremely bad maternal accident right in front of the hospital, and it just showed that there's no monitoring. So now there's a little app that sends notifications to the pregnant mother. There is an algorithm that sends out and paces the text messages that pregnant women receive. They can get messages even in their very remote villages. And there are over 70 women connected every month now that are monitored. And with the Cameroon Regional Health Authorities and the hospitals in several Cameroon regions, it is now estimated that that several hundred women have had their lives saved every trimester. And this startup called Alintef now introduces a kind of minimal safety net for these women. Today, hospitals in Yaoundé use this application, helping to respond to this very urgent, vital need to save lives using an economical system. And so it can be scaled up very quickly and not be too costly. Here's another example, Gimbi, Ethiopia. Gimbi is a very rural area in the Omoro region, difficult to access, very remote owing to its geographical position, and politically really is a region that is completely out of the reach of public services. And this is an application for midwives. Now, you have a midwife who's a man here, but the application works for him too. These applications can be contains videos that can be downloaded via Bluetooth that provide training to midwives teaching them a number of emergency gestures or interventions. So small videos, also cartoons, and so midwives watch these videos every day, download them as soon as there's a notification of a new video having been uploaded. And maternal and child death rates in Ethiopia, that averages about 59 deaths for 1,000 births, in the pilot areas where this application has been deployed, that rate in some cases has dwindled to 14, so from 59 to 14 deaths per 1,000 births. So real progress. Here's another initiative called CardioPad. This is a well-known project. It has a big reputation, and it has survived, its initial launch and the first few awards it has won. It is now completely deployed in many health services in Cameroon. And now the startup is working with the government, with the Digital Affairs Ministry, etc. CardioPad is a tablet-based system that helps to track the cardiac pathway. Cardiac diseases in Cameroon have really taken off. Several tens of millions of inhabitants, but only 50 cardiologists in Cameroon. Mostly concentrated in the urban areas, although they are still underserved. And rural areas, of course, are even more acutely underserved. Secondary cities like Bamenda, for example, are still far from Yaoundé. Traveling to Yaoundé to see a cardiologist is simply not an option, while cardiac diseases are on the rise. So with this tablet-based application, it's possible to go and see patients, scan the heart, and have a cardiologist analyze these scans. So 3,000 such tablets have been disseminated and are being used. There's a strong partnership with the Cameroon Ministry of Health that has equipped healthcare professionals in 20 hospitals around the country. These professionals have been trained in using the CardioPad. There's a partnership with cardiologists via a program called Africa Cardiac Care for the individual monitoring of patients, and via the association, interpretations of the scans or images can be done within the hour. Now, this is not a program for elite patients or elite hospitals. The subscription fee is very low, just a few euros a month. And this really addresses or helps to restore health inequality. It's a very inclusive application, and including the poorest, they can all be monitored and receive help via this application. So Cameroon, again, this is in Bamenda, which is a small town in a rural part of Cameroon, and there's a real shortcoming in terms of public services there. There are political troubles there. This is the Anglophone part of Cameroon. Nigeria is only 150 kilometers away. The startup is called ServiceCan. Conrad Tanku is its founder. The idea is a frugal microscope. This is true low-cost, reverse frugal innovation. It's a 3D printed digital microscope that can screen biopsies. And so the ServiceScan is really there to screen female cancers, breast cancers, and cancer of the uterus, about 50% of all forms of cancer in Cameroon. So using this device, the ServiceScan staff can go to the most remote villages in the western part of the country. They hold information meetings in the villages and then do screening. And biopsies can be taken in order to determine cancer risk for the patients there. And the project launched early 2017, or rather in September 2017, and 1,200 women poor women have been screened, and 150 cases of cancerous cells have been pre-identified. Then the women are managed by hospitals or monitored by hospitals via special partnerships. So that's 150 potentially saved lives. These cancer patients could never have been screened without this system. And the startup is now looking for investors in order to be able to cover the rest of the country and perhaps screen for other diseases in Africa, or to work in the same conditions in other areas, remote areas. So these are projects that have come out of startups, out of the minds of entrepreneurs. You might say that, right, this concerns at the maximum 10,000 people or so. But look at this case in Rwanda, a highly innovative country. Last week at the Vivatech Fair, Rwanda was really highlighted as a big tech country. Rwanda is really revolutionizing its healthcare system, in particular in the fight against maternal death. After the genocide, the rates of maternal death in childbirth were very high, and the ministry developed a system called, an application called Rapid SMS. And in the country, you have about 12,000 health workers across Rwanda. Rwanda, as you know, is a mountainous country. It's called the country of 1,000 mountains. Sometimes for an ambulance to go out and save a hemorrhagic pregnant woman, the trip might take 5 hours. So that's a challenge. But with this application, health workers can detect those women who are imperiled, pregnant women who are at risk during their pregnancy. A short report can be drafted and sent by SMS, by text message to the central platform. From then on, an entire chain of health services can be organized. For example, a further checkup after 2 weeks, or predicting possible big difficulties in this or that village, and then orienting the patient towards a hospital, getting the hospital ready to receive that patient. So the number of deaths per 1,000 births has dropped down below 40. So that's more or less the international average. And today, Rwanda, as highlighted by a UNICEF study, Rwanda reports that in 5 years, 500,000 lives have thus been saved. Rwanda, again, this is a project which is somewhat out of the bounds of eHealth or digital technology, but it really is about creating digital facilities that never existed before. Rwanda was the first to set up a drone port, an airport for drones. Initially, the project was meant to deliver blood pouches to health workers working in remote villages in the remotest part of the country in under 30 minutes. An estimation was done by the Ministry of Health. When I was talking to the Ministry of Digital Affairs in Rwanda, that's when they told me that on average, the average trip for ambulances was 5 hours. 5 hours, whereas by using a drone in Rwanda, you can cut down in the delivery time for blood pouches and other medical devices to less than 40 minutes. Here's one of the last examples. And we're not talking small scale here, but when public authorities decide to use digital tools to address health emergencies or crises, it can really have a big impact. For example, the Ebola virus, you know that it had a terrible impact in Africa. When the Ebola virus arrived in Nigeria, everybody expected a huge catastrophe. We were all watching terrible reports. You know, Fox News was being highly catastrophic. Africa painted in red, reporting 1 million deaths a day, etc. But it was really panic stations when the virus hit Lagos. But in the space of 2 months, the WHO estimated that in the space of 2 months, Nigeria was able to eradicate the Ebola virus thanks to data analysis using digital tools, using the skills of developers that develop tools for awareness raising and so on by tracking text messages. This was the result of cooperation with telcos working in crisis situations, tracking messages where patients complain of symptoms of Ebola. Doctors can come in very quickly and isolate patients. And thanks to this SMS-based system, the disaster was averted. So there are several eHealth initiatives that I went to see at work in the field and that are now part of the list of the eHealth Observatory, which is part of the Pierre Fabre Foundation. And we're going to have an award ceremony very soon. And Mr. Moati from Marseille spoke just before me, and I'm from Marseille. I also know a few people at IRD, including Sonia Varnes. And in Marseille, in November, 19th and 20th November, I'm organizing an innovation summit, partly on reverse innovation, but digital technology as well, called Emerging Valley at the Palais des Pharaons and at the camp in Aix-en-Provence. And we have received the Digital Africa label, which is President Macron's initiative to support digital technology in Africa. And I would like to conclude with a 2-minute video presenting this summit on reverse innovation in Africa. And it spans agriculture to digital technology, education, and so on.
Cette édition 2017 qui a réuni plus de 400 participants, 20 speakers internationaux. Au total, on avait plus de 40 speakers.
Comment créer des ponts, comment tisser des liens avec les startups africaines.
C'est un échange de procédés, c'est un échange d'expériences.
Un petit peu cette réciprocité de gagnant-gagnant. On n'est pas là pour expliquer tout, mais on est là pour travailler ensemble.
Un des objectifs de notre ambition, c'est d'arriver à remplir ce trou dans la raquette du financement.
Les PME en Afrique, c'est jusqu'à 20% du PIB, 60 à 80% de l'emploi. C'est une opportunité du coup d'avoir un type de collaboration qui n'est pas que gouvernementale, qui n'est pas qu'entre grands groupes.
Effectivement, il y a des opportunités énormes pour travailler ensemble.
It's a wonderful opportunity to work together.
Entre l'Afrique et l'Europe et la France.
Co-development by startups in Africa and Europe, that's the challenge.
Forts qui se développent en Afrique, notamment
there are lots of
cette révolution qui n'a jamais eu lieu et qui a lieu maintenant et qui fait prendre à l'Afrique une longueur d'avance dans une partie de sa population, notamment les jeunes.
And which is now taking place in Africa. 4 young people out of 10 by 2050 will be Africans.
D'égal à égal. Se retrouvent pour imaginer un
It's a
monde
great place
meilleur,
for people to meet as equals to invent the future of tomorrow that will address the energy and digital challenges that we are facing. We are dealing with young companies that will create value and create value together.
L'année prochaine, on veut faire une triangulaire
Next year, we want to have a triangulation between Provence, Africa, and Asia, with more startups from Africa and startups from Asia, showing that we can be interconnected and work together. You know, we'll soon be 9 billion, hoping for a better planet.
Donc voilà, donc rendez-vous à Marseille.
So we hope to see you in Marseille in November.
Merci.